Good morning, everyone. Thank you for joining us. Hope you're enjoying this beautiful weather. It's going to be 60 degrees today. Haven't we all been waiting for this moment? I want to welcome all of our district managers this morning from all of our community boards, and I want to welcome the Department of City Planning and also the New York City Test and Trace Corps and New York City Department of Health and Mental Hygiene. We're going to start off by hearing from the Department of City Planning, whose primary purpose is to purview is land use and is instrumental in designing the city's physical and socioeconomic framework. DCP's ambition is to make all of New York a better place to live, to maintain what works and improve what doesn't. With us this morning is Davis Parrish, Director of Business Improvement and Affairs, and Veronica Pappas, Public Affairs Officer for the New York City Department of City Planning. Mr. Parrish and Ms. Pappas will deliver a presentation on the zoning application portal, better known as ZAP, Z-A-P. And I think Kasha is going to lead us off this morning, although I've mentioned them. So I want to welcome you, and you may start your presentation. Good morning.
Thank you. Thanks for that introduction. I'm actually going to be leading the presentation as David had a last minute responsibility for City Council that he had to complete. For the chair of the department. But I'm the business improvement officer working directly with David. And as you mentioned, Veronica Pappas and also Sarah Whittam, who you heard from a little bit earlier, they're both here to serve as backup and also answer any questions. So I'm going to go into my presentation, if I can find it. Okay. So you may have heard of, and as the borough president mentioned, what we're here to talk about is the zoning application portal, or our new online filing system, ZAP. And so here to provide an update on the system itself and walk you through a bit of what the new functionality on the website looks like. So the first thing to mention is that applications are now available on ZAP Search. ZAP Search is the public-facing zoning application portal that allows both the public and community boards to view applications and projects in their respective areas. So at this time, all certified referred applications are now online. The process is digital at this point, and applications filed after March 2020 will be up in the next few weeks as we fully transition our documents onto the online system. And we'll walk through what that looks like in a moment. Another thing to mention is that the referral process is going to transition this April. So at this time, documents are found on box.com, and that will be changing in April. Emails will be sent directly to you to direct you to documents on ZAP Search. So all of the as I mentioned before, referred applications will be up on ZAP Search, and community boards will receive an email notifying them to look at ZAP Search for these documents starting in April. Third thing on here is there are multiple training and help opportunities. We have Veronica Pappas on the call here. She is instrumental in providing community boards with assistance in navigating both the public-facing portal as well as the online land use participant portal, which is community board specific. It's for community boards to use. You may have interacted with her already, but if not, she is there for you. The email to reach anyone to assist on either of those two interfaces is zap_feedback_DL@planning.nyc.gov. And we're also hosting a community board open house virtually this May to go into more detail about the land use participant portal. It is a new functionality that we've added in the last year or last 2 years. So you may be somewhat familiar with it, but now that we're getting more things online, it certainly becomes a more active part of the process. And so we're offering some more information in detail later this May. We'll be sending out some invites. And the last thing we wanted to talk about is what we've heard from you. There have been a number of comments, given that this is a new system, around specific bugs or enhancements that folks would like to see to the land use participant portal or the zoning application portal. And we just want to talk about that a little bit, inform you of what our future plans are and what we've heard from you, and see if you have additional comments. As I mentioned, this is the first update that certified and referred applications are now up online, and applications filed after March 2020 will be up in the next few weeks. During this transition period, you may notice that there are some documents that are not available on the zoning application portal for whatever reason. Because we're trying to endeavor to put all of our past applications up, this is a slower transition process for some of the older applications. And if a project is missing, we encourage you to submit a FOIL request. So going to NYC Open Records and selecting our agency. We have listed here our Records Access Officer, Wendy Niles, who can assist with that as well. Are there any questions about this or what this process, or what we mean by this?
When you say that documents may be missing, why would documents be missing?
They would be missing just because we're transitioning from a paper system. And when I say some documents or projects missing, this may be like a much older project filed before 2020, maybe in a paper format, in a file somewhere that we have, but it's just has not been made available digitally yet. Okay. But we're intending to, and so that would be a reason to request it.
But with new applications, we don't anticipate that. No,
a new application should be available online, and certainly as of right now, if someone were submitting documents today, they go up online.
You finished your presentation?
No, I just wanted to ask about this. And then
all right. Any chairs and any district managers have questions on this specific area?
Okay.
Seeing none, we'll move on.
As I mentioned, the referral process is going to change this April. And this is just phasing out of Box.com, which you may be familiar with. This is where the referred applications live today. And instead, these will be living on Zap Search, and emails will be sent directly to you to direct you to documents on Zap Search. Hopefully there are no questions on that, but if there are, please raise them. And then I'm going to load up the zoning application portal so you can just take a look at it, and I can navigate to some projects. You can see how that functions.
Mr. Borough President, I have a question. Florence Coloris, Board 1.
Yes, please go on.
I want to pivot back to the last item. So let's say we have a gas station. It's an old application, 1960, but it's up for renewal and we have to look at the application. Are you going to have it, or we're going to have to FOIL for it?
Sarah, I don't know.
Sure. So, not everything that comes through your review will be up on Zap Search. It's certainly something that we'll hope to evolve. If it's a subject of a renewal at the Department of City Planning, the application should also include pertinent information from the older application. But if you need the full older application, which would be, if it was from the 60s, in a storage box in a warehouse in Queens, actually, you would need to make a FOIL request, and then we would have to search for that box, retrieve that file, scan it, and then we could make it available on the project page on Zap Search. So, now that we're now in the fully digital age, thank goodness, going forward and over the last year, everything will just be available. These older ones, will be incrementally taken care of over time. But as I'm sure you're aware, that would be an expensive process, staffing resource. So it'll be something that we will continue to address. And through FOIL records, once those are digitized, then we will certainly make them available on this website.
My concern, I used a gas station as an example because it came
Okay.
to mind, but I know that's a BSA. My question is, if we have to FOIL honestly, how long is the FOIL going to take if we need an old document? My concern is, I have a land use chair that's very, very thorough. How long will a
Sure.
FOIL take?
I understand. I think there's a I think it's a 40-day turnaround for the initial request. That doesn't include time it takes to try to locate the file. So, I mean, that includes the initial time to try to locate the file. So it could take a little longer. So, all of that is in the FOIL procedures and rules. We do our best to address them as quickly as possible.
I'm on mute.
Okay, thank you very much.
Sure.
Okay, now I'm going to get into just quickly to share the portal itself.
I had a quick question.
Sure.
Just to piggyback what Florence said, we are the community boards and the city agencies. And my question is, why would we have to FOIL for a request when we're the first line and we have to approve or disapprove? So can you just address that for a moment? Thank you.
Hi, this is Sarah. So
Hi, Sarah.
I appreciate your concern. We even direct other city agencies to use the FOIL process because it's the way we can track and keep track of what we're doing and how timely, we're measured on all of those things as well. So it's just the system of organization for retrieving these old records. If you were to send just an independent email, that could get lost in the system. There'd be no way to track what you had asked for and how he responded. So, so we pretty much route everybody through that. But certainly with our sister agencies, there's extra attention, to make sure that, we get you what you need as quickly as possible. Does that help?
Not really, because that just makes our process longer and harder to get the information to our very active land use chairs. So
Sure. I do understand that. And, frankly, in the paper-based system, if it's something that's within the last 8 to 10 years and we have it in record storage in our offices, then we can do it much faster. If it's something going back a long way, that means, retrieving something from a warehouse, looking at a file, seeing if we have what you need. So that's just the process. Anything that we have in our office certainly can be retrieved much quicker, and we do so. So we're here to help you. We're not here to stand in your way. So, when you make the FOIL request and you also reach out to the planner assigned to your district, often they have things in their borough offices as well. So we do our best to respond as quickly as possible.
Can I give you a little feedback?
Sure.
DCAS has a program. So we're digitalizing some stuff in my office. And what happens is after you digitalize it, they put everything into a spreadsheet for you. And you're able to go back and find your old documents, because what's the point of digitalizing if you can't access all the stuff that you're putting into the computer? So DCAS then goes ahead and puts everything into a spreadsheet, and they teach you how to use the spreadsheet. And with that spreadsheet, you're able to look up by you're able to look up by multiple ways. You're able to look up by address, location, numbers, and it's for all city agencies. Why aren't you looking into using the DCAS program?
How do you get the documents then once you go into a spreadsheet?
They're in the computer. They're digital. So I have all my liquor licenses right now. No, my land use, my cafes, all digitalized. So if I want a copy of Christos Taverna in Astoria, Queens,
Sure.
I'm able to go in, put in their address, or put in their name, or put in their street. The computer will then find the file, bring it up, and then I'm able to have a digital copy of the file. And this is for all city agencies. There is,
Okay.
but
I understand. And so Kasha's going to walk you through how we're posting all our land use applications online now so that you can see everything that we've got in a very similar way, including other information that tells you about the project. So she's going to walk you through that right now. I'm interested to hear about who you work with at DCAS on that. And if you wouldn't mind sending an email to Zap Feedback with that information, I'd like to know a little bit more about it. I think you'll find that this site, what we're doing here is going to be very user-friendly for you. We've put things up here, everything that we've gotten since March 2020. We will continue to be adding. And as for things going backwards, as we have the funds and resources to digitize past applications, we'll be putting them here as well. So why don't we let Kasha walk you through how this looks?
And I just wanted to circle back before you move on to what Debbie mentioned. You know, we shouldn't have to FOIL for information.
I certainly, I hear your concern. We'll take that back.
Okay.
Yep.
Alrighty.
We'll take that back to folks. Sarah, if you could drop, it would be helpful, I think, maybe to put the Zap Feedback email in the chat for folks.
Oh, sure.
Just
I'll
so
do
that
that
you
right
could
now.
send over that DCAS information. This, as we mentioned, is our digital repository of public files and land use applications. And as Sarah mentioned, anything that was filed after March 2020 is going up online. Certified applications are available in this portal, and we're consistently adding new things. So previous paper documents are going to be scanned and put into these records. This is the zoning application portal. That's zap.planning.nyc.gov. And you can see here, you can filter to find certain projects by project status. At this point, we have filed, noticed, in public review, completed, and unknown. Those are the project statuses that we have up. And you can check them and filter for particular projects. I'm going to check in public review. You can then text match. You can say, I'd like to look for projects in Queens, or you can take a look at community district. So let's say you would like to look at Queens 1. You can filter for all community, all projects in public review in community district 1, or any other community district by action type, zoning resolution, borough, block and lot. So if you have a BBL and the borough, certified date. So a lot of different search criteria to find particular projects. And then once you find that project, you can click over, you can see that there are 2 projects in Queens Community District 1 that match this criteria. And then click into the project itself, and you'll get the project brief, as well as if you click this little arrow, there are public documents. And those public documents are listed here. So you can take a look at and download the land use application. It'll come up. We're in the process of making, one of the enhancements that we have is to make that drop-down menu a little bit more intuitive and sort of clearer for folks. So the documents are listed in order. But you're able to download the application and take a look at the application from the system and find those projects. Sarah, I don't know if this is one. There's also, yeah. So you can also take a look at where the community board has reviewed and put in their
vote. Yep.
their votes, and take a look at that. So that's another part as you scroll down.
Could I just add a note that often community boards, as you're well aware, will put in a letter or memorandum explaining their vote. And we still want you to submit those through our land use participant. We're working to write the programming that will make those publicly available on our website. So it's that's one of the things that will be coming, is so when you say, Florence, you may have uploaded a document that explained your vote. It's not showing here right now, but we have it safely in the system. And once that we have on the schedule to get that work done, it will become available the same way you see the documents that we post for the application. So I urge you all to use the LUP portal as fully as possible. It's very easy to see here that you had a conditional favorable. It's right there. It has the vote, and soon, sometime soon, it will have the actual document you uploaded, which is fantastic. Thank you for doing that.
Any questions about this functionality? As I mentioned, we will be having an open house in May to go a little bit more in depth on this particular portal, as well as the land use participant portal that Sarah is referencing, that community boards specifically access to input their votes and other documents. Great. So if there, yep.
Oh, could I just point one thing out, Kasha, while you're on this screen?
Sure.
You see in the lower right-hand corner, that question mark in the orange circle
I will highlight it.
on the screen? That will take you right to basically Zap Feedback DL. So if your question, if you submit it through here, it will, and send the message, we'll get it the same way if you did a separate email to Zap Feedback DL. So I just wanted to point that out to you. And we're hoping to be able to build some articles for some quick help. You see on other websites sometimes FAQs or, how do I do X, Y, Z? And those are things that we hope to have coming. In the meantime, you can just simply click on that question mark, put in your email address, write in your question, send the message, and we'll get it. And Veronica triages those. You've spoken with her frequently. And I look at them, several of us in the background look at them and work to assist you. Thanks, Kasha.
Yeah, just to quickly close out the end of this presentation, wanted to, as Sarah mentioned, there are some ways in which, can you all see my screen?
Yes.
Okay. Feedback and help opportunities. I've mentioned the community board open house a number of times, and so be on the lookout for that invitation. Sarah's mentioned Veronica, and then the email address that she dropped in the chat, as well as that accessible little question mark on the portal itself. That's a really easy way. If you're in the in either of the portals, it's also on the land use participant portal. If you're in either of those and have questions, it's a quick way to catalog those questions easily. And the last thing to mention is what we've heard from you, some things that we know are pain points or things that community boards would like to see in the land use participant portal, and Zap Search. This first one, Sarah went over the recommendations not appearing online. This is something that we're hoping to address in a future near-term update. Similarly, these are other pain points that we are hoping to address in near-term updates around more than one person at each board having access. We know that that's a pain point for some folks because at this time there's only one email address that is given access to the land use participant portal. If there can be an undo or edit feature, connecting to the city record, and sending email notifications. I did mention you will be getting an email notification starting in April about when documents are available on Zap Search for you to take a look at, those referred applications, but we know that there is a desire for additional email notifications as well. All of these things are cataloged in our list of enhancements or features to build into new updates that we are addressing throughout the year. Since this is a new piece of technology, there are always going to be new things that we want to address and functionality to better serve our users, and you being key stakeholders in this process and certainly prime users of the system. We want to take in that feedback. So if you have any other things off the top of your mind or questions about these pieces of feedback, please let us know. But if there aren't any other questions, then I think that is it.
Thank you.
Thank you.
Questions on FOIL though, so please get back to us on that.
Yes, we'll follow up and get back to you.
All right, thank you.
Thank you very much.
No problem. All righty, we're now going to move on to the New York City Test and Trace Corps, the New York City Department of Health and Mental Hygiene. The New York City Test and Trace Corps is a public health initiative to fight the threat of COVID-19. The Corps is a group of doctors, public health professionals, and community advocates working to reverse the COVID-19 outbreak in our city. The public health program is led by the New York City Health and Hospitals in close collaboration with the New York City Department of Health. With us this morning is Laura Atlas, Director of Government Affairs for the New York City Test and Trace Corps. Ms. Atlas is accompanied by Chelsea Cipriano, Executive Director for Government Affairs for the New York City Department of Health and Mental Hygiene. Both Ms. Atlas and Ms. Cipriano will deliver an update on the ongoing operations of the initiatives to combat COVID-19 in our city. And I want to welcome them both. And I guess we'll start with Ms. Atlas. Good to see you again.
Thank you so much, Borough President. And hello, everybody. We have a presentation that we're going to go through to talk both about test and trace, sort of where we are as a city in terms of the COVID outbreak and our continued efforts to combat it. And we are also going to talk about vaccines broadly. I'm going to go ahead and share my screen. All righty. So what we are looking at right now on the left is a heat map. The darker an area is, the more blushed it is, the higher the COVID rates. So even though broadly, as you can see on the right from the epi curve, our infection rate and our new case rate and 7-day rolling average continues to decline, there are still a few areas throughout the city where we're seeing particularly concerning spikes. I think the great news is that we are really starting to see the impact of the vaccine. And we'll talk more about how many people have been vaccinated and sort of the plans to continue distribution. But we also want to make sure that folks are continuing to seek testing and follow all of the core 4 that we have been talking about the whole time in terms of how to prevent infection. We are still not out of the woods yet, although certainly we are beginning to see the beginning of the end. And then this is a list of all of the testing resources currently in Queens for this week. We update these weekly. We have a couple of different modalities. So we have our mobile testing vans. Many of you have sent us recommendations that we've used time and time again in order to ensure that we have a lot of coverage for testing all throughout the city. We have self-swab, which also can be set up. It's kind of our only indoor testing at the moment. And so that can be set up anywhere. And again, a lot of these recommendations have come directly from the community boards themselves. And then of course, we continue to have the permanent sites. And so those will continue on. In terms of preventing COVID, nothing has changed. The variants won't change this. Vaccines won't change this. The things that we need to keep in mind are staying home when sick and getting tested. Again, that's why we've continued to ramp up testing resources. You will see that we are capable at this point of testing well over 100,000 people every day in New York City. And I think we're glad to report that people are continuing to get testing, even though vaccine rates are going to continue to rise. Wearing a face covering, and I believe we'll talk a little bit about what the new face covering guidance is, keeping 6 feet of distance and avoiding indoor gathering. One of the things I think we're also benefiting from on the positivity rate is that we haven't been through a large indoor gathering season in a couple of months. So we saw a really intense holiday spike after we went through Thanksgiving, Christmas, Hanukkah, Kwanzaa, New Year's, that was a very intense amount of gathering that we know really drove the rate up. But indoor gathering has not been as common in the last couple of weeks. And so I think that's also contributing to the lower rates. And then continuing to wash your hands, using hand sanitizer, all of these things remain critically important, as well as avoiding non-essential travel. In terms of our new mask guidance, so I think always one is better than none, but the general rule we are going for is that all masks should be able to seal on your face. So the reason we're going for a double mask, if you have a surgical mask and then a cloth one, is so that it can properly fit your face. Sometimes the surgical mask can kind of peel on the side. And so really important that we are doubling up if you're using a surgical mask. If you're using a KN95, then you don't need to double mask because that seals very well to your face already. On that note, I'm going to hand it over to Chelsea.
Thanks, Laura. Yeah, before I launch into vaccine, or maybe as I launch into vaccine, I think, the health department and Test and Trace feel really strongly about what Laura was mentioning in the last slide. We are very excited about the vaccines and the promise that they hold, but you don't throw the oars out of a boat just because you see shore. We are still very much in the middle of an active pandemic. We are seeing worldwide, in Europe right now, cases are increasing. We really need to remain vigilant. With the introduction of new variants here in New York City, which we are reporting on our website. I want to make sure folks are aware of that. On the health department's website, on the homepage under COVID, you can see data on the surveillance that we're doing on the new variants. These are variants of concern. They are more transmissible, and it just really drives home the point of why we all need to continue wearing our masks and doing the other core 4 actions that Laura mentioned. Keep getting tested, and if you do test positive, or people that test positive, you're taking advantage of the great resources that Test and Trace has set up through the 212 COVID-19 number. Just wanted to pause on that for a moment and make sure that really sinks in, because we are so excited about vaccine, but we really need people to remain vigilant in everything that we're doing right now, because this is concerning, and we can't undo all of the great work that we've done by letting our guard down right now. So very quickly, these are the vaccination by the numbers so far. We have administered over I think the number today, it's not on the screen, we should probably add it, is I think over 2.3 or 2.4 million doses administered into arms in New York City. This is very exciting. And we have obviously more work to do with a hyper focus on equity and what we're doing. Next slide. And you can see on the corners of the screen, we've added QR codes. So if you're watching from home, you can just put your phone right up and try to scan that. It'll take you right to the data page where all of this lives. All of this data is on our website. We have numbers by zip code, we have demographic numbers, we have numbers by age. And so all of that for vaccination is on the health department's website now. So really encourage you to go check it out, including the numbers that were on the last slide. So these are just screenshots. If you go on our website, you can hover over the exact zip code and get all of the information you want. You can download it in an Excel format. So definitely encourage you all to check this out. This is the adults vaccinated by zip code, where, the darker the blue, the better. So we're working on that as we set up access points across the city. Next slide. These are just some really quick vaccine basics that we want everyone to know. The vaccines are safe. Want to say that out loud. It's right here on the screen, but this is what we want folks to hear and know and trust. They have undergone rigorous testing. They are recommended even if you've had COVID. So if you've had COVID and you're thinking, maybe I won't get the vaccine because I've already had COVID, nope, please get the vaccine. You can get COVID more than once. And we really, really, really recommend that folks who have COVID or have COVID antibodies think about that and ensure that they're getting the vaccine as well when they're ready. They don't contain the virus and they do not alter your DNA. We have 3 vaccines right now. They have FDA emergency use authorization. You may have heard this as EUA, the Pfizer, the Moderna, the Johnson & Johnson. You might have also heard it called Janssen. The Pfizer and Moderna are mRNA vaccines and require 2 doses. The Johnson & Johnson is a viral vector vaccine and requires 1 dose. And this is important. Even after getting vaccinated, people need to continue wearing face coverings, keeping distance, limiting gatherings, so really practicing the core 4. We're not ready yet to throw away those masks. I know folks are excited to do so, but we're not there yet. So we still need to remain vigilant even after vaccinated. Next slide. This is just a little bit about how the vaccine actually gets to New York City. We've gotten a lot of questions about this, about how distribution is working. So the federal government manages this. New York City receives an allocation proportionate to its population. And we have all of this data on our webpage about vaccines coming into New York and then going out the door into arms. This is a note, just I think folks are aware supply is limited. We're getting additional vaccine from the federal government, so this is really great. So we're really working to scale up additional sites. That includes, I want to say this very clearly, not just standing up city sites, but getting vaccine to providers who are already the existing healthcare system is so important here. Not everyone wants to go to, a city-run or a state-run site. They want to go to their provider or their pharmacy. And so a lot of our work is getting the pharmacies and small providers, including FQHCs, geared up to receive that vaccine, whether they need help, getting ready for storage purposes or getting registered in our citywide immunization registry. This is just as important as standing up those additional sites because we want the existing healthcare infrastructure to be ready and be able to provide the vaccine to their communities as well. So all of this means vaccinating more New Yorkers as we get more supply and increase that access. Next slide. This is about the distribution and eligibility. Hopefully folks are aware now, but the distribution of who gets the vaccine when is based on CDC guidance, but then really the state determines the eligibility categories. So this is a risk-based approach. Basically, those who are at increased risk of exposure or severe illness, if they do get exposed, are in the first tranches of those getting the vaccine and eligible to do so. So healthcare workers, people over 65, people with underlying conditions, frontline essential workers, including restaurant workers and TLC drivers and others. The list is quite long now, and we have it all here on our COVID vaccine distribution page. But if there are questions about when is this category or will this category, why not this category, I hate doing this, but I unfortunately do have to refer to our colleagues at the state just because they are the ones making those decisions. We are happy to help raise voices and make sure that certain groups are heard, but the decision does lie with the state. Next, so this is very quick. I just want to go over this 2-pronged approach of, enhancing access and enhancing confidence in the vaccine. And we need to do both simultaneously. So this is just a little bit about how we're expanding sites. If folks want to make an appointment, they can do so through our platform, vaccinefinder.nyc.gov. This now tells you if there are first dose or second doses available. That's something that we heard loud and clear that people really wanted. And so if there aren't first doses available, it'll tell you so you don't have to go into the system and look for that. You can also call 877-VAX4-NYC for folks who don't want to use the internet or may not be able to. That's totally fine. You can now sign up for appointments on this hotline. You can also arrange free transportation through this hotline. And sign up through the new program for homebound seniors to indicate interest in getting vaccinated. So you can do all of that both online and over the phone. Finally, I just want to note that we are partnering with DFTA with NYCHA on pop-up locations in NORCS and NYCHA developments, but also working with community-based organizations to help enroll people in their communities in vaccine appointments in their communities. So ensuring that particularly in our 33 racial inclusion and equity task force neighborhoods, people who live in those neighborhoods near those hubs are getting the appointments. And we're doing set aside appointments through CBO partners. It's been quite successful, and we're really grateful to the work of those CBO partners, because this is how we get this done. Trusted messengers and work within the community, really building that confidence, which I'll get to next. Next slide. So this is about building vaccine confidence. We know for a range of reasons, historical and current day racism and bias in the healthcare system, just general mistrust of vaccines and misinformation that's out there. We need to do a really good job, and we're working on this with trusted community voices to get accurate information out there. We need to elevate stories of people getting the vaccine. So those of you, you are all community leaders, and those listening at home, if you are getting vaccinated or intend to get vaccinated, tell people about it. People in your friend, family, community circles need to hear this from you, that, you may not be eligible now, but I will get the vaccine. I know that it's safe, and I am ready to, combat COVID. We need to hear our friends and family members saying that to build that confidence. So we have some resources. We've been doing tons of town halls. I think we've done almost 1,300 events now just in the last 2-ish months. We're doing community conversations, which are small group conversations, really to address vaccine confidence and hesitancy. Train the trainer sessions, where we're training CBO partners and community leaders to essentially be navigators through this process for their communities. And then just on the ground, canvassing, flyering, robocalls, all of the good stuff that we know we need to meet people where they are to get this information out. It's a campaign video with a lot of great facts and information. Definitely recommend that folks check it out and share it with others. Sorry, we're almost done. Finally, this is the kind of, okay, so what can I do about it slide. And we definitely need your help. Number one, if you're eligible, get the vaccine. And this is how you do so on these websites and this phone number, and encourage others to do so as well. As Laura was saying, as I said in the beginning, we are not out of the woods yet. We need to keep getting tested and practicing the core 4. And they're here, and you're probably sick of hearing us say them, but they're more important than ever right now. And then really encouraging others and doing so ourselves, accessing accurate information about the vaccines. We have a ton of great resources, fact sheets, flyers, posters, videos, pretty much more than you could ever want in at least 13 languages across the board. So please check these out and share them with your communities. And then when you do get vaccinated, or if you intend to do so, please share it on social media using these hashtags. I think that's it from me. We are more than happy to take questions. And I think, as always with COVID, but particularly with the vaccine, there is always more to come. So stay tuned. We'll be announcing more sites, more access points, and more initiatives. It feels like every day right now, but we are excited and appreciate your partnership in all of this.
Thank you so much for that, Chelsea. Let me just hop in quick. Can you give me a breakdown of where we're at in Queens? How many people have been vaccinated in Queens?
Let me pull that up very quickly. I should have had it on my fingertips. I'm sorry that I don't. Let me just go grab it off of our data page. If you have another question, I can do this. I can multitask.
Okay, cool.
Over.
Yeah. And then, the question I have in terms of, and I know you're doing testing, but I think a fair critique I would have on the rollout of the vaccine is you have people going into sites to get tested. Why don't we turn those sites into vaccination sites too? Because a lot of those particular spots are also in areas hardest hit. So I have not seen a real mapping plan on that. And I'm assuming since people went and got tested at these sites, they may be more comfortable. So I'm not sure if there's, a contradiction in asking to have both on those sites, being that the community understands where those sites are. And I'm not going to take all the questions, because I know that there, others will have. And then I guess Brent is on, who's my COVIDs are. The question he's going to tell me to raise is like, when is Queens getting J&J? See, Brent? You
Good
got
job,
your programming.
Appreciate it.
So when can we expect J&J in Queens? And then if you can give the breakdown of the numbers, and then I'll go to the district managers for questions.
Yeah. Laura, do you want to tackle the testing question and talk about kind of where we are doing the crossover of sites where we did testing and now are doing vaccine?
Yeah, there's certainly some overlap. Places like the H&H facilities, the pop-ups, many of them are doing vaccinations. I would say a couple of things. The vaccines are a little different than the testing modality, right? The testing, essentially all you need is a swab, which is very easy to purchase and maintain. The test sites themselves, and I would also say some of the test sites have actually been flipped into vaccination sites like Brooklyn Army Terminal and Bathgate. There is very different equipment required. And so I think the effort being made is to put that equipment in places, one, that have the space to handle it and have the space to handle capacity as well. So, I think, again, with testing, folks wait on the line, they register, they get tested, and they leave. It's a very quick process. With the vaccines, you have that additional observation period that people need to be able to stay around for. And so we can't just move it into sites that don't have the ability to accommodate that observation as well. But again, there have been crossovers, and we're starting to do the pop-ups. We've been in 24, or we're going into our 24th NYCHA development this week. We're also beginning to do it with houses of worship. And a lot of these places have served as mobile testing sites previously. So like Queensbridge houses, for instance, we did a pop-up there. And so that's about bringing the vaccine directly to folks in the same way that we were able to do it with the mobile testing. And I should say that the vaccine is not actually in a mobile unit. We actually bring in the vaccine allotted for how many people are scheduled for the day, and they're in a community room. So a little bit different in terms of the ways we can move vaccine around.
Thank you. I'm going to go to Christian from CB4, and as I await my numbers.
Thank you so much, Borough President. Good morning, everybody. Thanks, of course, the Department of Health for joining us this morning. So I'm like I said, as the Borough President said, I'm Christian from CB4. We represent Corona and Elmhurst, also known as, or rather formally known as, the epicenter of the epicenter. One of the things that we recently had a speaker from the Department of Health come to our office and, discuss test and trace. But one of the questions that remains that we're very curious about, and we've all done this, is whenever we go to restaurants, we put our name on this list, we get our temperature tested, we'll put our signature and our phone numbers, but what exactly happens after that? Where is it traced? My number's in here, now what happens? If the person next to me got COVID, will I find out with the guy from, what happens then? What's the step, a series of events after our names are on these restaurant lists? And what do we do? Please.
Sure. Laura, do you want to do a quick rundown of contact tracing, or do you want me to handle as a facility?
I can do contact tracing broadly, and then you can do facilities. So broadly speaking, tracing, when we're talking about tracing, I think a lot of people are thinking of it as when you're being traced, people are trying to determine how you contracted COVID. The truth of the situation is that most people don't know where they contracted COVID unless it was in their household or at work. Those are the places where you tend to be exposed to people for the longest amount of time, and you tend to know if somebody has tested positive. But by and large, if you're in a restaurant, if you're in a gym, if you're on the train, no idea whether somebody is COVID positive or not. And so the real goal of the tracing is twofold. One, to make sure you have everything you need in order to be able to isolate adequately. I think one of the things we really learned, and this is especially true in denser areas where there's a lot of, multi-generational living, and there's a lot of sort of doubling up or tripling up of folks in small areas, is that the ability to isolate is really key to stopping chains of transmission. So that's why we have this robust hotel program. Anybody who's tested positive or believes they're positive or believes they were exposed is able to participate in that program. It's completely free of charge. It's wraparound services. I should say, it's not just like a regular hotel where you sort of go and you stay and at the end of it, you check out. It is a clinical hotel. There are on-site medical services. The idea is that you should never have to leave isolation for any reason. And so a part of that is also, if you can isolate in your own home, what resources do you need in order to make that happen? So for instance, we have a dog walking service, we have food delivery. Any of the things we heard over and over again were really concerns for why people could not isolate adequately. We've tried to solve for. And then, also counseling in terms of like loss of income is a big concern that we hear often. And so counseling folks about how to get signed up for unemployment benefits or any of the other benefits that HRA offers is also a big part of what we're doing. And then the next goal is to figure out who you may have been around when you were contagious. And so then we go on to contact those folks, make sure that they have the resources that they need in order to be able to isolate, and so on and so on. But Chelsea, do you want to talk broadly about facilities?
Yeah, sure. So when the facilities investigation is really one when it's at like a workplace or a school or other settings, kind of the where of where you were during contact tracing. And so for restaurants, to answer your specific question, if we need that information to assist with the investigation, as we call it, I know for restaurants that has a certain connotation, and think of like health inspectors busting in with like jackets on. That's not what this is. This is very scientific, doing the contact tracing process, asking who you were in contact with so we can stop transmission in its tracks. That's what that information is used for if we do need it during that investigation to identify additional close contacts and let people know that they may have been exposed and what they need to do in terms of isolation and quarantine.
Thank you. All right. Any other questions? Go to Frank, CB6.
Unmute. There I am. So thank you again, Health and Hospitals, for coming. We really appreciate it. My experience, Borough President, you might be interested in, over at Aqueduct and Resorts World. Both were great, the test site and the vaccination site, but one was the city and one was the state. And they weren't exactly in the same spot. Now, there was some confusion where you went, getting in for your test, that's fine. There was a lot of signage, but then the state, and I know it's not you guys, but the signs were so close to each other, it was confusing. And there was some people there that were on the test line that should have been on the line for the shot, probably vice versa also. So just to make note of that, but they did a great job. We were in and out. Everybody was wonderful. Has nothing to do with that. I just thought the direction for people going there, a lot of seniors still going when I went, and a couple of weeks, 2-3 weeks ago. That was a confusion that I noticed, and maybe we could reach out to them just so they could tighten up their signage a little bit more, because it is a large facility. By the time you drive in, you make a right for the test and trace, and then you have to literally find out where the shot, where they're giving it out in the building. So I get it. I understand. It's been not the norm like we know things today, but if you can make note of that, that would be great. But again, and thank you for all you've done. I know you guys have come out to my office and we did a test situation here a couple of times, and that was great. And with the walk-ins were unbelievable that day. But thank you.
And we continue to have capacity. So if people have ideas for places where we should be adding testing, we're happy to do that. I would say on one note, the Aqueduct is actually run entirely by the state.
Oh, the whole thing is by the state? Oh, I didn't know that. I thought one side was city and one side was state. I did not even know that.
No,
Interesting.
we do have a test site at Beach 39.
In Richmond Hill.
that I know.
Is that a pop-up? Is the Richmond
Richmond
Hill one a
Hill.
permanent? The church. I thought we did a church there.
I didn't
So
know
you
that.
have
I'm sorry.
capacity for more pop-ups. So if people have on testing, you're saying, right? You have more capacity. Okay, great.
We always have
Brent, let's
capacity.
make some notation of that, because there's still some pockets that we should push for. All right, I'm going to go to Jonathan Gasca, CB14. You have to unmute, Jonathan. There you go.
You hear me now?
Yep. Yes, sir.
Okay. So good morning, everybody. Quick question. I have a neighbor who's a senior, I guess it's 80. And I've been trying to convince them to go get a vaccination, and I finally did. And I said I would help out and look. And I've been going on the city site. And it seems like certainly yesterday and today, every Walgreens has availability in the borough of Queens, and it seems like in the world. So my question is this, are seniors not going there? And if they're not going to use that, why can't we have, for example, they're trying to get teachers back and allow teachers and school staff to start using that? Because I remember a few weeks ago and a month ago, you know, unless you got lucky and you went online, you couldn't get an appointment anywhere. Now it seems like you can go any time of the day and go to a Walgreens or a couple other drugstores, which I think is great that there's that availability. But also leads me to believe that seniors are either not going or they went already. So is there any way we can open it up to some other groups, especially, for example, and my wife's a teacher, but teachers and school support staff, since, you know, that's a big concern. Why not go to the Walgreens?
Yeah, totally hear you. Two things. One, seniors are going to Walgreens, but we also know that they're going to the pharmacies in their neighborhood that they know that they've been going to for, you know, many, many years, and to their doctors. We've heard loud and clear that that's where they primarily want to go. And they're taking advantage of some of the bigger city run sites, or the like more local to their homes, like in NYCHA and now the Homebound program. But the state has said that pharmacies can only vaccinate 65 plus right now. So that's a rule that's in place. So we can't expand the Walgreens or others up to other right now.
And the rules are the rules. I get that. But you could change. And it seems kind of a waste. I mean, I've been looking for a few days now, and there's always availability.
Yeah.
And they're not going there. And has the city gone to the state and said, hey, can we allow teachers and school staff or some other category if there's availability? Because there's obviously vaccines that are sitting there that are not getting used. And there are a ton of people, especially teachers, because you want to get them
You're
back.
stealing my thunder, Jonathan. So
Oh,
we're
I'm sorry.
actually sending a letter out. It'll be news to them, requesting that vaccinations be able to happen in the schools. You have school nurses. I'm not sure if they are eligible to give the vaccine, but teachers should literally be able to get the vaccine in their school buildings.
Yeah.
So that's something we're actually working on internally to push on.
Okay,
News to
thanks
them
for
properly. I'm gonna go next to, hold on one second. We gotta know, we're taking the list of who raised in what order. Hold on one second. Joseph, CB11.
Hi there, everyone. I just want to thank Borough President Richards and the Health Department for putting this conversation together. I want to say hello to Chelsea, my old cubicle mate over at DOHMH. And I want to thank you guys. I know that we've been in contact a lot about the Community Board 11 and looking for a permanent site. And I also want to thank you guys for the 2 pop-up sites that we've gotten in Board 11 over at KCS on 32nd Avenue, and also Common Point, the old Sam Field Y. These are great things. We know that you guys hear us. We know that you guys know that we're a transportation desert. We're looking forward to a permanent site, and we're looking forward to that. We have a lot of residents out here that still haven't gotten vaccinated, and we don't have subway access. So, you know, we are still looking forward to that, but you know, we'll take the progress where we can. We know that it's a heavy lift.
Yeah, thanks, Joe. And I think you've definitely reached out about site locations already, I know, but feel free to continue to send those suggestions to me. I want to make sure we're elevating them to the right people at the Vaccine Command Center.
Yeah, thank you, and I appreciate it.
I think I saw Debbie next. Debbie?
Sorry about that. Mine was a quick question, and it was really that age category. I want to say from 60 to 65. That's a touchy category as well. And a lot of people, again, frontline workers, municipal workers, teachers, and people that work with the public should as well. So I just wanted to put that on the table, that's 60, you know, people that are 64, 63, they're just itching also to get their vaccines. And we don't want them to go to waste or get thrown out.
Anybody want to answer?
Yes, we don't want them to be wasted either. And I think, you know, we're looking at the state for additional categories of folks who may be made available or eligible soon, as we have additional supply.
Have you partnered with senior centers? To me, that would be like just a natural constituency. Each senior center has their own constituency, and you may, I mean, we've worked hard, at least in South Queens, with York College and the centers, but have you thought about that? And then I'll turn over to Brent if he has any questions on my side.
Yeah, we have worked with senior centers really closely through DFTA, particularly as we're doing this new authorized scheduler program where we're training up CBOs and the DFTA partners to schedule people for appointments. It's actually pretty cool. They can schedule people. They can then go in and look at details of the appointment if folks need it. It's really meant to be that like personal touch by someone that the community members trust. So that's been a big point where we've been engaging folks, because that program is starting right now with 65 plus.
All right. Brent, you have any questions?
Just-
all right. I'll go to Yvonne first and I'll come back
Sure.
to you. Yvonne,
Yep.
TV12. Unmute yourself, Yvonne. They're gonna make like a record after this phrase. Whoever trademarks this probably will become a billionaire. Hit me, mute, unmute. About the trademark. Unmute yourself and put it on t-shirts and mask. Oh, that's a good idea.
Oh, on the mask, and mute yourself. You need the opposite, right? You can choose which one you want.
Exactly.
You have something there.
Yeah, exactly. I'm on to something. Oh, I can't have second income, I don't think so. That's out the window. Yvonne, all right. We're gonna go to Brent while Yvonne figures this out. Oh, there you go. You're unmuted now. There you go.
Thank you. First of all, I would like to compliment what's happening at York. They are doing, I was there last Friday, and they are doing a great job. I mean, you know, they just keep you moving, and people really don't have to wait a long time. And I have a question. You stated that the state, the pharmacy, they can only do 65 plus. Is that weekly or monthly?
That's just the general rule for the age requirement, not a number requirement. It's only 65 years older. Yep, years and older. Yeah, sorry, I misstated that.
Thank you.
You're welcome.
All right.
Borough President, I unfortunately have to run, but Laura will be here to carry on. I do want to give you a number. I've been trying to calculate it from the website, but 18% of Queens adults have received at least one dose at this time. So I will work on getting you a hard number.
Is that including the
is
state
updated
numbers,
now.
or is that just city?
Yes, that should be including the state numbers.
Okay.
Our community, our citywide immunization registry does include those vaccinated by the state. Yep. Okay, thank you so much for having me, everyone.
Thank you, Brent.
Thank you.
Hi, Chelsea, you're signing off, right? Because I just wanted to follow up to that. If you got a second.
I can, but I can pause for a moment.
Sorry, you just said
That's okay.
18% of Queens residents received at least one dose, because we looked at numbers yesterday of adults.
Yes.
Okay, so that doesn't, what you mean 18 and above? Because yesterday we were looking at numbers and I think it said something like 8%.
The data, Brent, why don't you and I will get like the firm numbers and we can reconcile these. I believe it is 18%, but let's talk after this, and I will make sure that you and the borough president have the most accurate numbers that I'm looking at.
Great, thank you. And then just a follow-up, and Laura could take this because I know you have to run. I know we discussed in the past basically coming out with clear language differences between the Pfizer and Moderna vaccines versus Johnson & Johnson, and how that would appeal to a lay individual like many of us. Wanted to see the status on that, and if there's a clearer description that we could offer our constituency. Thanks so much.
Yeah, no, before we were doing this, I was like, Brent is going to ask about that fun, like a fun email equivalent that I can give. And I don't have it yet. We are working on it. It's hard. This type of vaccine has been around for a long time. It's a little bit more complicated than explaining an mRNA vaccine, but it is still front of mind. I know that people need to understand how this thing works, and we want to give them the explanation of how it works. I think not everyone here was on that conversation. So I'll just take a moment before I run to just reiterate. I'm sure all of you are getting questions from your constituents and community members kind of about the difference between these three vaccines. And I didn't do a pause and good job of explaining that. So let me just very, very quickly, the things to remember are, number one, all three are safe. They're all life-saving, and they are all effective at preventing COVID-19. The best one you can get is the one that you can get right now. So folks, shouldn't feel like they have to wait for one or the other. As we get more supply, people will be able to choose which vaccine that they receive, because we have the type listed all on the vaccine finder. You can see which vaccine is at which location. So to the question asked earlier, when will we get J&J to Queens? You can check now and see if sites in Queens are starting. They will be populated with Johnson & Johnson on the vaccine finder. And then I think, it's very appealing to compare one to the other. That is, we caution against that. It's kind of an apples to oranges situation, because the Pfizer vaccine and the Moderna vaccine were tested at really different times in the pandemic, right? So they were tested much earlier, whereas J&J was tested recently, where transmission rates were higher, variants were in play. And so they were tested in different places in different countries where there were variants. Even under all of those circumstances, all three are exactly what I said: safe, effective at preventing COVID-19, and life-saving. So Brent, I still have homework that I owe you. I hear you. I will figure out a way to explain the J&J vaccine simply, but those key points, we really need all of your help amplifying to your community members, so that they're not, looking at one vaccine as better than the other. So thank you. With that, I will sign off. Appreciate your time. Thank you so much, Borough President. Good to see all of you.
Chelsea. Thank
you.
you. Brent, that was it? You good?
I'm good. Yeah.
All righty.
And thank you, Laura, for all your continuous help. We speak to Laura every other day. So thank you.
Yes. Oh, wait, I think we have one more question, Florence, CB1.
Actually, she just answered my question. I greatly appreciate it. Yes.
Great minds think alike. All righty. Is this it? All right, well, I want to thank everybody for attending. Look forward to the work ahead. As I think the mayor has just announced, actually, NYC Vaccine Corps are hiring up. So if you know people, I guess that means if you are eligible or trained to administer a vaccine, then go get to make some money if you're watching this.
You don't even actually have to have a clinical background, because part of what we're looking for are folks who can help us run the sites. And so there's a lot that goes into a site that doesn't necessarily involve administering.
Okay. Can you get us flyers on that? Is there some flyers so we can put that out? I'm sure there are a lot of people who would look to make some money and keep their community safe. So I look forward to that. So thank you. If you can email that to us, we'll get it out. Thank you all for attending. Hope you learned something. I got some information that was important or critical to you. Share what you got. And